Welcome back to the No Morning Show here on TTT. It's time for a spotlight where we look at those issues that are affecting all of us. And of course, this morning we're talking about the importance of being vaccinated, because it seems at this point, at least, that is the answer to getting out of this pandemic. So let's welcome to the program Professor Terence Seemungal, Dean of the Faculty of Medicine at the University of the West Indies. Good morning to you, Professor Seemungal.
Morning to you, and morning to the viewing audience.
Thank you so much for joining us, Professor. We really appreciate it. So, you know, especially with the latest restrictions that the Prime Minister announced yesterday, can we agree that the way out of this, the quickest way out of this, is to get vaccinated?
Yes, you're quite right. In fact, Israel has recently completed vaccinating all of its people above 18 years of age, and they have opened up. People are allowed to walk about now as they wish, and it's obviously a different society from what was there up to 3 or 4 months ago.
Right, and we see even England, I think, has vaccinated upwards of 70% of its population. Yes. As well.
And they are gradually beginning to relax their restrictions.
Right.
Without the vaccine, it will be very difficult. We will keep getting peaks and then troughs when you tighten up. So you know, there's no way around it, really.
Right. Well, how important is it for us to get vaccinated? Because we still seem to be having some vaccine hesitancy here in Trinidad and Tobago.
Yes, that is true. Part of the problem is the PR that goes around that's been accompanying some of these vaccines. It's not been terribly well handled. But apart from that, if you ask why we should be vaccinated, there are two important things that people need to remember. The first is that we've had 174 deaths from 11,000 odd cases that have been diagnosed, which means a death rate of 1.5%. So if you extend that over 1 million people, that's 15,000 deaths. So that's huge. But the other thing is that about 1/5 of people who get this illness, that's 20%, wind up in hospital. And of those, of every 20 that do wind up in hospital, about 5 will need intensive care. So as your numbers increase, you will pretty soon have nowhere to put your patients. That happened in England, happened in China, where they had to very rapidly construct hospitals. So if you look around you, you see what was the effect of not having appropriate preventive measures. But then there's something else that people need to bear in mind, that while the disease is very mild in the 80%, of that 80%, some may still have long-term symptoms afterwards. Something called long COVID that's not clearly defined at present. And of those who have gone into hospital, there is the possibility of having other complications over the next few months. We have a clinic at the REMA that is devoted to this, practices at quite a 21st century level. As far as I could tell, I was at a meeting on Sunday just hearing about it, quite impressed. We have 6%, every 6 cases discharged every day. We're getting 13 to 14 new admissions. So you're right. That scenario that you're painting, that according to the Ministry of Health and its experts, we will be overburdened within 10 days if we continue with this trend. But Professor, we're talking about this vaccine hesitancy, and I think it comes out of the anecdotal, and I'm saying anecdotal evidence, that there seems to be some correlation between blood clots and the AstraZeneca vaccine, which is the one that we're using here now. Could you talk to us about that? Sure. So the answer is yes, there is the possibility of clots occurring in the body by a very, very different mechanism from what is the normal mechanism by which clots occur. For instance, people know that if you are inactive for any long period of time, confined to bed, there is the risk of clots in the legs, for instance. We call them DVTs. But the clots here occur because of a phenomenon that directly affects one of the proteins that's attached to platelets. It didn't show up in the studies that were done because it's very rare. So how rare is it? Estimates are at between 1 in a million to 4 or 5 in a million, maybe as much as 10 in a million. So the problem is that how does one gauge risk in such a case? You say, okay, you can get a very rare complication. So as I was telling people at a UE meeting a few days ago, risk is something that is not difficult for the clinician to talk about because we think in those terms all the time. But for the average person, we actually do it subconsciously, so we don't really consciously think about it. So let's take some data that perhaps we know. You know that you can get into a motor vehicle accident and die if you get into your car. But you get into your car, if you have a car, or if somebody gives you a lift, you'll get into it every time, well, almost every time they offer you. The risk there is about 163 deaths per million. The risk with this one, that's this rare complication, as I just said, is about 10 or 4 or 5. It varies in different populations per million. So you see there's a huge difference. But one risk you take every day and the other risk you don't. Let's go to something that's about the same size as this. About 5 per million worldwide is the number of deaths worldwide that occur from airplane crashes. But people will go in airplanes to travel.
So then, Professor, what do you think is responsible for people not wanting to take this risk with the vaccine? Is it the PR?
It's how it was handled. So the European Medicines Agency never classified this as a reason to stop using the vaccine, but several countries panicked in Europe and they stopped using the vaccine. You notice that the UK never stopped using the vaccine. What they've done, they have put out the appropriate public health advice. So because they stopped, it has given people the reason to believe that something really bad has happened. But can I say something more? That any drug that you use or intervention that you use in the body, there is the risk of side effects. The aspirin that people use to prevent heart attacks can cause tremendous GI bleeding. It can also cause bleeds in the brain. But the risk is very rare and the benefit to risk ratio is huge because you're preventing heart attacks. And it's the same thing here. What we have to do is to explain to people that if clots occur, this is what you do. And in the UK, they've actually put out a public health notice so that people know if something happens, there is services. There are services they can access. So and the medical fraternities alerted to the what this would appear to be. So, for example, severe headaches, difficulty in walking, etc. All of these would be reasons for you to go and seek medical advice. And most times it won't turn out to be anything bad, but on a rare occasion that it does, then the health services will admit the patient and decide what they need to do about it.
Right, and is there any correlation between those with underlying conditions and the ability to develop blood clots as a result of the vaccine?
Okay. The answer is no. The short answer to that is no. There has been no pattern, except that in Europe, it has tended to occur in people under the age of 60. So that's it. In fact, people who have underlying conditions of cardiac disease, hypertension, diabetes, etc., the so-called NCDs, are at great risk of having complications from COVID. These are the people who die. Obesity, these are the people who die from COVID. Have to go to the intensive care unit, have prolonged morbidity. So these are the people who need to definitely get vaccinated. They're not at any greater risk of side effects of the vaccine. The one side effect of the vaccine that you have to remember is if you have a severe allergic reaction to any of the components of the vaccine, then you shouldn't have it.
Right.
So that's, that's really the only contraindication.
And from your medical expertise, Professor Seemungal, let us look at the vaccine themselves. We have quite a few of them on the market, approved by the WHO. Are they created equal? Is there one that, do you believe that there are vaccines that are better suited for different people, whether it's because of the tropical, conditions, whatever it might be, or DNA?
Yes, okay, so that's a reasonable thought, but I mean, how do I answer it? The answer is, we can't say at this point in time because such comparative studies weren't done. So I mean, if you think of the AstraZeneca vaccine, which is the one that we have, there are very good reasons for preferring it in a tropical climate. One is because, especially our type, because the need to preserve the vaccine is not as great as, say, the Pfizer vaccine, which has to be kept at -80 degrees. So, and if it's not, then you lose the efficacy or the usefulness of the vaccine. This one is very cheap and very easy to store compared to the Pfizer vaccine. So from the point of view of practicality, this one is better. But if you're asking me about from a health perspective,
yes,
then we don't have that data available to be able to answer you.
Right. And one of the things I'm always curious about is, know that the government has taken the decision to use all 70,000 vaccines for a shot. If we go beyond the 12 weeks that's recommended for the second shot, will it affect us? Will we have to do 3 shots? Will it affect the efficacy of the vaccine?
Okay, so first of all, there was no rigorously conducted study to compare data that would allow us to answer that question. But from analysis of the data of the studies that were done for this vaccine in particular, that's the AstraZeneca vaccine, it was clear that people who were vaccinated at 12 or more weeks had a better immune response than those who were vaccinated at 6 or less weeks. So right. The 12-week vaccination, or 12 or more, is better. The WHO advised that if you go past 12 weeks, you should be vaccinated as soon after that as possible. But there is no need for you to be vaccinated at less than 12 weeks.
Right. I understand the less than 12 weeks, but I was wondering how much longer than the 12 weeks we're allowed to go without losing efficacy. But you're saying we don't have that data as yet.
Yeah, we don't really have it. I mean, how long is the vaccine antibodies going to be there? Because what the second shot does is it boosts that immune response. Yeah. And that data isn't quite clear. So, I'd be speculating.
So there are still a lot of unknowns even to this point, but we have seen at least where countries have benefited from vaccinating their population. Do we still know as yet, Dr. Seemungal, if people can transmit the virus, contract the virus after vaccination?
Right. So there is evidence that you can contract the virus after you've been vaccinated, but it tends to be mild infection, if at all, or asymptomatic infection. Now, the rates of these are decreased, it would appear, but it appears that it can still happen. So even when you're vaccinated, you must continue the public health preventive measures, at least until most of the population is vaccinated.
Right. So as of now, Trinidad and Tobago, we just have to continue maintaining that social distance, washing our hands, wearing our masks, all of those things.
Yes, yes.
And the rate at which we're vaccinating and the availability of vaccines, do you think we'll have herd immunity in the next 2 years?
Right. Again, a very reasonable, good question. I don't have a full answer to that. All I could say is there were projections made in The Economist looking at that, and they felt that by next year, most of the developed countries would be fully vaccinated, but it would be some time after that before the developing countries could be fully vaccinated. And the reason is that if you think about it, where are the vaccines being produced? They're being produced in the developed world, and they must see about their populations. First, I must say what I found encouraging was a recent meeting that I attended with the Caribbean, Central American, and Latin American countries, in which I saw that vaccines are actually being developed in Argentina, Brazil, Mexico, and of course there's the Cuban vaccine that's gone a long way. So if we have more vaccines, so those projections that I've seen before were not based on vaccines being produced within the third world. They're being, I don't know how soon they're going to come on and how efficacious they're going to be, but if they do come on quickly, then we will be able to complete our vaccination in the third world more quickly.
Yes, I do agree with you. I've been paying attention to that Cuban vaccine, Sabonara, or something like that. And they have, I think it's 3 versions of it. So definitely paying attention and hope that will come on stream soon. But Professor Terence Seemungal, when it comes down to the whole vaccination and COVID here in Trinidad and Tobago, I mean, for now, right now, with these lockdown measures, do you think we will be able to maintain numbers, relatively low numbers, if we continue on this trend? Or should we even consider the economic effects? It's one thing you save lives. I know the government always have to do that balancing act, but you save lives, but then livelihoods are dying.
That is a very, very, very difficult challenge to meet.
Yeah.
One also has to remember the effect on the economy of having huge numbers of people in hospital. That is a huge drain on the economy. And so therefore, you have to, if you look at the pattern, you could look at the pattern worldwide. You keep getting peaks and then you get troughs, and peaks and troughs. And during the peaks, people tighten up. And if you don't, the peaks keep rising. I don't think that the government has much choice here, short of having vaccinations. You need to tighten up.
Yeah.
If you don't, it's going to rise, and it's going to hit the country worse in the long term.
I think the government...
What we could, if the population would just focus on these public health measures, washing of the hands frequently, mask wearing, and keeping the social distancing going, we could open up a little faster, but they must follow these basic public health guidelines. It's difficult. It's not our nature as people to do that. We are a social species. But
definitely. But Professor, I think it's obvious that the government understands its responsibility. Do you think we as individuals understand our responsibility in this fight against COVID?
Some of us, because some people have it and they don't seem to be much affected by it, it's given rise to a feeling of hubris amongst some sectors of the population that they can get away with it. They don't realize that they can have asymptomatic infection, I guess because it's asymptomatic, that they can spread to other people. And the other people can suffer. You have to be your neighbor's keeper here. We must remember that. And we have to be as thoughtful towards our neighbors, because in the end, the population as a whole will benefit. And that is what is going to keep Trinidad or get us back to where we were before the pandemic.
So what should the message of reinforcement be so that people can understand that we're all in this together, and even though you may fall in the 80%, there are others who are going to fall in the 20%. Out of that 20%, there are those who are going to need intensive care, and there are those who are going to die. What is it that the government needs to reinforce in the messaging so that people understand what's really at stake?
We have to try to better understand. So there's a worldwide movement of vaccine skepticism. That, for instance, has damaged the polio vaccine in the sense that polio started, when we thought we had beaten polio, it was recurring. So, and then on that basis, there are various myths, for lack of a better word, or beliefs that are different in different sectors of the population. In fact, after the last vaccine symposium that the UE and the Ministry of Health in Trinidad and Tobago held at the Eric Williams Medical Sciences Complex in February, we approached the ministry with the need to look into this phenomenon of vaccine skepticism, and the Faculty of Medical Sciences, jointly with the Faculty of Social Sciences, looked at it, and we have generated a report which we will be sending to the ministry probably today or tomorrow. And one of the things is that we need to understand a bit better of what's going on in the different communities in Trinidad. If you notice, and I'm sure the ministry has, but don't know if they've put that data out as yet, but it did appear to me, based just on my personal observations, that the uptake of vaccine was different in different parts of the country.
Yeah.
I know, for example, of some people who left Port of Spain and went elsewhere and walked in and got the vaccine, but in their own area they couldn't because the lines were too long. So if we could understand that, we could reach people more, and then to make it applicable within their environment and address their own beliefs, so that they would see the importance of using the vaccine.
Professor, we're out of time, but in terms of the P1 variant, what's the latest you can tell us about that? I understand that the University of the West Indies has been testing people, I think it's those who are repatriated, to see how many P1 variants we have in the country. What's the latest you can tell us about that?
It's highly infectious, more so than the original strain that was in the country. Variants of the vaccine occur, of the virus occur all the time, but some are, well, let's say, worse than others. And the P1 variant, which was first detected in Brazil, has now come into Trinidad and Tobago. Inevitably, these things would happen.
Yeah.
What you need to do is maintain the public health measures.
Apart
the
from being more
AstraZeneca vaccine
infectious,
has efficacy against this variant.
Apart from being more infectious, is it more deadly, as in will people, have, more severe symptoms when they catch that variant, or no?
That part is not clear. But because more people will get the virus, there is the risk of greater, larger numbers of people being infected for the health system to cope with. So from that point of view, it is more difficult to cope with.
All right, Professor, we're going to have to leave it there, but thank you so much for speaking with us this morning.
Thank you.
Yes.
And good day to everyone.
Yes. Professor Terence Seemungal there from you is speaking to us about why it's important to be vaccinated. And he says, yes, there might be, the AstraZeneca vaccine can cause some clotting, but you're talking about 5 to 10 in 1 million. And you compare that to any other risk you take, it's a non-starter. We take a break and we'll be back with you.
Vaccine that the girl them want, Put it in. Your ladies, man, the vaccine them vaccine.